Imagine you are in your later years in life and you're stuck in the hospital due to having terminal cancer that doctors cannot cure. You see the pain and sadness of your family every time they come to visit you, which is every day because you only have a few months left to live. You cannot live your carefree life anymore. You love to explore and be active, but now it even hurts to get out of bed. Imagine if there was a way for you to be dignified and ending your life with peace. Euthanasia and assisted suicide should be legalized in the United States because of the physical, financial, and psychological burdens it could alleviate. According to Kimberly Holland, who wrote What is Euthanasia on Healthline, there are currently 8 states in the United States where physician-assisted suicide is legal, along with 8 other countries. Many people have to witness their loved ones go through pain and suffering near the end of their life before they pass away. Imagine if they had the choice to end their life with dignity. Today we will discuss why this should be legalized through discussing what euthanasia and assisted suicide are and who it affects, what main ethical issues face the legalization of this, and where the circumstances in other countries where it's already legalized. Euthanasia is the intentional termination of life either by ending life-sustaining treatment or by actions causing death directly that the physician carries out. Assisted suicide is when physicians prescribe you lethal doses of medication and you take it yourself. These should be legalized because it offers people to have the choice to choose to die with peace and what is best for them in certain circumstances. Many of the patients affected by this are usually older individuals who have to seek outside help, like hospice care, 24/7 nurses to their home, or even staying in the hospital due to what kind of care they might need. This would lead them to believe that they're living with less quality of life. They can't live like they used to. They can't take care of themselves on their own, and they just feel less autonomy overall. Euthanasia and assisted suicide can offer relief to those who are terminally ill or suffering because of lessening this pain, the financial burden, and psychological effects that it may have if they had to live. However, how and when a person can and should decide this brings up many ethical issues. The ethical issues facing euthanasia and assisted suicide are what makes the legal debate complicated. One major ethical issue is the comparison between deliberately ending life versus deliberately ending life support. Euthanasia deliberately ends life support, and assisted suicide is deliberately ending life. This brings up the fact of a person has the right to die, but not the right to be killed. From Ewan Gallagher's article, Physician-Assisted Suicide and Euthanasia in the ICU from Critical Care Medicine, consent changes the fundamental nature of an act, which is why we pay people to perform surgery but send them to jail for a knife assault. With euthanasia and assisted suicide, people consent to ending their life, so they're choosing this for them. Although some people believe that it is murder, but people should have the right to choose because it's their own body. Another ethical issue which faces the legalization of these is professional ethics. According to Catherine Frederick on Euthanasia and Magel's Medical Guide, when faced with pain and suffering, the American Medical Association asserts that it's a doctor's responsibility to provide adequate comfort care, not death. Many medical professionals question this ethical debate. Some want to offer it, some don't want to offer it, and it somewhat goes against their code and their oath that they take as being a caregiver and a doctor. This leads to many physicians not wanting to do this, or they're being fearful of facing those murder charges that other people might believe. However, if this was legalized, they wouldn't have to face these fears. And on the contrary to the AMA's statement, people believe that providing comfort care means providing comfortableness to the patient no matter what it means, even in death, if that's what they choose. In Kevorkian belief, it should be seen as a rational way to end tremendous pain and suffering, included in Catherine Frederick's Euthanasia and Magel's Medical Guide. The last legal issue facing this is the individual's right to choose for their own body versus society's position on suicide. Legally, most states allow the refusal of life-sustaining treatment, but many don't see choosing suicide, which is what, through lethal doses, which is what both of them offer, because they consider this suicide, assisted suicide, and even murder. However, from Ewan Gallagher's article, Physician-Assisted Suicide and Euthanasia in the ICU from Critical Care Medicine, We know that for many dying patients, the motivation for requesting physician-assisted suicide may not be physical suffering, but loss of control, pointless suffering, deterioration or loss of dignity, and weakness or tiredness, for which there are no effective medical treatments. People should have the right to choose what happens with their own body, including death, especially when death may be the only treatment to some of this suffering, physically and psychologically. Which is why many states and other countries have started to legalize euthanasia and assisted suicide starting in 1994. It's already legal in many of these places, like I said, but specific requirements are needed to be met to comply with these laws that they have in place. Two examples are Oregon and the Netherlands. Oregon has the Death with Dignity Act, in which patients must be 18 years of age or older, a resident of Oregon, capable of making and communicating healthcare decisions to healthcare practitioners, and diagnosed with a terminal illness that will lead to death within 6 months. This is from the Public Health Division on Oregon Death with Dignity Act. The Netherlands has similar requirements for their Dutch termination of life on request and assisted suicide review procedures act, such as the physician must be satisfied that the patient's request is voluntary and well considered, be satisfied that the patient's suffering is unbearable with no prospect of improvement, and have informed the patient about his situation and prognosis, etc. This is from an article, Cross-Sectional Research into People Passing Away Through Self-Ingesting Self-Collected Lethal Medication by Martin Hagens in the Journal of Death and Dying. These requirements are super important because not every person should be able to access this type of care if it is legalized. These requirements allow for the better control and get to people who really need it. Through these requirements, people suffering from pain, loss of autonomy, financial burden, less enjoyable life, dignity loss, losing body control, they're able to end their life with peace and their choice of choosing this in the end, one of their last decisions they make. Many states have legalized this with these specific requirements so people can end their life with peace. In conclusion, you now know what euthanasia and assisted suicide consists of, what major ethical issues it brings up, and why it's important to have specific requirements to make it legal in more states for the future. People under qualifying circumstances could be happier with lessening their quantity of life, but improving the quality of their life. Along with family members, this lessens the burden for everybody. It's crucial to realize how much burden could be relieved because of the person choosing to end their life would lessen the financial burden on their family and have more time to prepare for this end of life care and even just death in general. It's an emotional topic. My grandfather passed away a few months ago, and I can only imagine how much happier he would be if he had the choice. You should legalize euthanasia and assisted suicide because of the effects it could have on you and your own family in the future. Thank you.